Hello, everyone. Welcome back to the Career Guidance Series US. I hope you're all having a wonderful day. My name is Luqman Siddiq, and I'm the coordinator of Alfaisal MedHub under the International Office at Alfaisal University, Riyadh, Saudi Arabia. I'm honored to be your host for today. For those of you who don't know what Alfaisal MedHub is, it's an initiative under the umbrella of the International Office College of Medicine that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. As you all are aware, the Career Guidance series are conducted in partnership with AMBOSS. Today, we are excited to bring to you a new webinar of the Career Guidance series US titled Nailing the USMLE Step 3. Which will be delivered by Dr. Eiad Habib and Dr. Omar Baqal. Dr. Eiad and Dr. Omar are recent graduates of the College of Medicine, Alfaisal University. They are both PGY1 internal medicine residents at Mayo Clinic, Arizona, USA. Thank you so much, doctors, for agreeing to take some time from your schedule for this webinar. You can start whenever you're ready, but before you do, I'd like to make sure if you'd like to have questions towards the end, or would you be taking them as they come?
Assalamu alaikum, everyone. Thank you very much, Sultan, for this introduction. I think it's better to keep questions at the end just so we can get on with the talk, and then whatever is left at the end we can cover, inshallah.
Sure. I'll stop sharing my screen.
Omar, can you share the screen, please?
I'm working on it. Oh, so I think I might need screen sharing permission because it's disabled.
Oh yeah, we're not hosts.
Come on, help.
Doctor, I think you can screen share now.
Okay. Yep, it works. Okay. Does that look good?
All right, yeah, it looks good. All right,
awesome.
Let's jump right into it. Assalamu alaikum, everyone. Omar and I are going to be talking about very brief overview of step 3 for those of you that don't know a lot about it. Omar, next slide, please. So what is step 3? Step 3 is the final step exam in the series of USMLE exams. It's a 2-day exam. We'll talk about the details of the examination days a bit later. And essentially it's a combination of multiple choice questions as well as CCS cases or computer-based case simulations. And we'll also talk a bit more about these as we get ahead into the talk. Now, just some quick requirements that you need before you're eligible for step 3. Number 1 is the ECFMG certification, which means that you have to be like really far into your medical school journey. You must have actually received your diploma before you're able to apply for the certification. Then once you have the certification, that's when you're able to do the exam. And the exam is only done at Prometric centers here in the US. It's not done internationally like step 1 and step 2. And then the cost of the exam is $895 as of February 2022. Very briefly, how do you apply? So this is the link. We're going to share these slides with you guys when we're done, so you can have these links handy. But essentially, go to this link and you create an account, you start a new application. Essentially, there's like a verification process with FCVS, and then after that, you're eligible to just submit an application. There is one form that they ask you to fill out, and then this form needs to be notarized. So what you end up doing, it's called the CIG form. You're going to find the link for this online when you're filling the application. All you need to do is you just attach your photo there, and then you go to this website, NotaryCam, and then you basically generate a request for it to be notarized. Just a quick tip: if you put a U.S. address in the application, you just pay $25 for notarization. But if you put your Saudi address, they take like $79. So just put any U.S. address, and you don't need a proof of address when you're when they're asking you to verify it. Again, this is just, things that are going to stay in the slides. You're going to refer to them later on. I don't think that any of you are going to need to go into these details right now. In terms of the timeline, once you're done with your application, so you get that CID form, you email it to FSMB, which is the organization that takes care of step 3, because it's not the usual ECFMG process anymore, since it's going to be the same for IMGs and AMGs. So you email it, takes 1 to 2 days to be processed and accepted. And then that's when your step 3 application goes under review. And then that takes about 7 to 10 days. And then you get your permit 2 to 3 days later. So essentially what this means is, since the first step of the registration process, it takes about 2 weeks until you're able to book your exam. Next. Very common question that people, wonder about: when should you take step 3? There are essentially 2 main ways that people go. The first way is before you start residency. So after you're done with your step 1, step 2, you got your ECFMG certification, hopefully applied to the match, and you're waiting that year. So some people do it then, just before they start, but then the majority of people do it during intern year. That's all the American medical graduates, as well as the majority of IMGs as well. And each of them has pros and cons. Really, the main pros of doing the exam before you start residency is for getting the H-1B visa, which is the non-immigrant visa, which is the visa that can easily be converted to a green card once you start the immigration process, and the years of training kind of count, unlike a J1. So it's one of the requirements to have step 3 done by a certain deadline before you start working to be able to, for you to be eligible for an H-1B visa. The most common deadline that I saw when I was applying to programs is by the end of March, so just after the match day. However, some programs had like stricter cutoff criteria, like end of December or end of January. And just one thing for you to keep in mind, the same thing that we have with step 1 and step 2, the score report delays that happen between July and August for step 1 and step 2. The same thing happens for step 3 in January and February. So if you want your score to be out by the beginning of January, your deadline is basically the end of December. Otherwise, you'd have to wait a couple of months and get your score in March. So these are really the reasons that make people kind of want to do step 3 before they start residency. And then also just because, your information, your medical knowledge is still more fresh. You've done your step 2 recently. You're not going to be as busy with residency and so on. So these are the things that make you do it before you start residency. Now, during your first year of residency, during your intern year, like I said, that's when the majority of people take it. During the year, some people say that you're more experienced clinically and you can better approach questions, which I think is true to a certain extent, but only because it's going to be related to the field that you're practicing in. So yes, at the end of your intern year, you're going to be more experienced with internal medicine questions, and you might get a higher percentage of these questions right on your step 3 exam. However, when you talk about things that you haven't seen for a long time, like surgery or pediatrics or OBGYN, then it would have been, a big gap since the last time that you studied this stuff for step 2. So it kind of, it offsets that potential advantage that we have. Some other people also choose to do it in intern year because some programs offer funding for resources like for UWorld, and also some programs even offer to pay for your exam registration. So if money is an issue, some people tend to wait and do it during the intern year. However, like I said, you have less time to study and more likely to have forgotten other disciplines. This is just something for you to keep in mind. Next. Now, in terms of scoring, we'll talk about the importance of scoring a bit later. Omar is going to touch upon that, but most people, they tend to score lower than their respective step 1 and step 2 CK scores. And that's partially because the percentile curves are shifted. So I just put here the 90th percentile curves for step 1, step 2, and step 3 from my score reports. Step 1 was 257, step 2 was 265, and for step 3, you can see that it's just 246. That's the 90th percentile. And that's because people study less and there is a more generous curve, and everything is basically just shifted downwards. So like I said, the curve is very generous, and despite that, the average score for step 3 as of, I think, December 2021 was 227. Omar, I think this is your part.
Yep, it's my turn.
Mm-hmm.
Can you guys see my camera?
Yep.
Okay, awesome. Assalamu alaikum, guys. Very nice being here. Great work, IO, for the webinar series, and we appreciate you guys having us here to share our experience with the step 3. First thing I want to talk about, and obviously everyone would have this question, is how important is the step 3? Because a lot of people do it in intern year, a lot of people kind of get it done with. So how important is it truly? I've heard mixed things, but I think the general consensus I've heard is your step 1 and step 2 will still remain pretty important, when you're thinking about applying to fellowships and stuff like that. I think step 1 and step 2 will still be considered strongly, along with or above step 3. So this is a survey that the NRMP conducted. This was from 2016, though it is still definitely a bit dated. They haven't done any others since then for fellowship. So they surveyed fellowship program directors to ask them what kind of factors they took into consideration to select applicants to interview, in this chart. And as you can see, step 3 falls in here somewhere. 79% of the program directors, keep in mind, n equal to 48. So there are 48 responses. And the average rating out of a 5 was 4.1. If you compare this with step 1, step 1, 81% of the PDs said they take that into consideration, average rating 4. So it's, pretty comparable. But, generally what I've heard is, and I think generally what the perception of even the program directors is, that a lot of people just do it in intern year, with the potentially less than ideal circumstances of studying and stuff like that. So they're just not sure how much weight to put on it. But definitely, an exam that you wouldn't want to flunk. You would want to do your best, prepare appropriately with the recommended resources, and do your best in it. And the next chart is going to show us a similar kind of picture, but this is for ranking applicants and what the program directors took into consideration. So as you can see here, so step 3, when ranking applicants, is far less commonly taken into consideration. Kind of makes sense, like, again, this numerical score that they can use as filter, but when it comes to ranking applicants, they may want to look at other aspects, for example, the interactions with the faculty and so on. So selecting applicants to interview, yes, pretty important. When ranking applicants, far less PDs took that into consideration, but those who did, they rated, the average rating was a 4.3, which means it's still, reasonably important, but certainly not as important as those higher factors that you see here, rated a 4.8, 4.7, 4.5, and so on. So for example, if you're applying for a competitive fellowship, you would want to give yourself this advantage by scoring well on it. Again, you don't want to deliberately do poorly on it. So especially if you're applying for a competitive specialty, you would want to make sure you at least, kind of get it done with a reasonably competitive score. Now, let's talk about day 1 and day 2 of the exam. It's an exam that's spread over 2 days. And if someone has certain medical conditions, they can request for accommodations for the exam to be done over 3 days instead. So that's something, important to keep in mind, might be relevant for some of the people out there. So first day, 7 hours exam. This includes, a 45 minutes break, 5 minutes tutorial. And many would say that the first day maybe feels more like step 1. The second day maybe feels a bit more like CK. On the first day, you'll see a combination of step 1 and step 2 style questions with reasonably heavy emphasis on biostatistics. You'll see plenty of questions on biostatistics, and I think when we talk about resources, that's where our recommendation of preparing for biostatistics comes in. And when talking about step one style questions, there'll be a few areas from step one that will be much more commonly tested. And these include microbiology, immunology, pharmacology, especially drug mechanisms, drug side effects. Those are pretty commonly tested even on step three on the day one. So one of our recommendations to prepare would be to review those sections from first aid. Day two is 9 hours, a longer day, and this day will include MCQs and then eventually the CCS. That's truly the new thing about step three, when you compare that to the first two exams. And you'll notice that day two will be more clinically oriented. There'll be more questions on risk factors, first step of management, first step of diagnosis. And again, generally may feel a bit more like CK, but obviously, there's the MCQs and then you'll have the CCS that Eiad's going to go into in more detail. So when talking about resources, honestly, looking back, this was probably the most unremarkable USMLE step experience. If you've gone through step one and step two, there'll be nothing shocking that'll come out of step three, especially from the MCQ. So CCS is definitely something new needs to be prepared for. But when talking about the MCQs, I think you know the drill by now. If you've done at least step one, you will know how to approach this. UWorld remains, I think, the gold standard. By this time, it has 1,900 plus questions. I just checked that yesterday on the website. So I think that truly serves as a very good resource to build the knowledge base you need for this exam, and it helps you go through these questions and it's kind of structure your approach and thought process as to how you would want to approach those questions. When it comes to biostatistics, so UWorld also has a biostats section that you can do. It has practice questions, and you would want to review the step one first aid biostatistics section as well. So you'll have plenty of questions of biostatistics, from simple questions about risk and so on, to those abstracts and medication ads that usually take a lot of time. And, they're like a set of questions, 2 questions, 3 questions. And the recommendation usually is to leave them for the end. Whenever you're doing the exam, if you come across those, just leave them to the end because they take some time. So that, and Randy Neal's YouTube videos. So he has those excellent statistics videos on YouTube, and I would recommend just watching them as a review. So to me, they were pretty helpful. So that's something you can consider as well. And as previously mentioned, reviewing step one material, more focused from those specific sections: microbiology, pharmacology, immunology, maybe some basic pathology. But you'll see that you'll get plenty of questions from those sections in your exam. Otherwise, they would be pretty straightforward. If you've done step one, you've done step two, and you have retained a decent amount of your knowledge that you gained over those 2 exams, you truly should be fine as long as you just kind of do a quick review of the material. When talking about countdown to exam day, if you put in months, and when talking about step 3, you'll probably be, a lot of people, their preparation is 4 weeks to 6 weeks, maybe 2 months. That sounds more on the higher side. And again, depending on your circumstances, how fast you're planning to get it done with, or are you in your intern year trying to give the exam, that will essentially determine what your timeline is going to look like. But generally, again, if you've gone through step 1 and step 2, you will know the drill. You will know what to prepare and how to prepare for the exam, how you want to mentally and physically get into shape for the exam. But this is just like more like a general advice. So, by the time you have reached a week before the exam, at this time, kind of start focusing on working on your weaknesses mostly. There's really not much new material you'll be able to, absorb at this time. I mean, if you've put in the work over the past few weeks or months, you should be in good shape by now. So just focusing on hammering out any weaknesses you may have. And then 2 to 3 days prior, at this point, you really is just final touches. Is this something you think you just want to, go over, review, do that? And then a day prior, just relax. I think it's very important to take that day before the exam, to not stress out, to not be freaking out, and just focus on yourself, on getting better, on just relaxing, get good sleep before the exam, and spend time with friends, watch something, something you enjoy. But that's very important. Stress relief throughout this process will be very important, and especially if you've gone through step 1, step 2, you'll know, that's the case. When talking about personal experience, I mean, again, I really, if this was step 1 or step 2 talk, I would have way more things to say. But I think for step 3, I truly have nothing much to add, except that, a question a lot of people would have is, how should I split those 2 days? How much time apart should I do them? I basically did my day 1 on March of 18th. That was after March 15th when I found out I had matched. And then March 19th, I found out where I matched. And then my day 2 was on March 22nd. So like there were 3 days in between. And I personally feel, that was sufficient. I don't see how taking a week in between would have helped in any other way. I did feel, okay, I would need 2 or 3 days in between. I want to relax, rest, and kind of pick myself up. But I think a week would have been a lot. But again, different people have different approaches to this, and see what works best for you, see how you feel, and kind of take it from there. But that was generally my experience. And then, definitely day 2 felt more exhausting generally. Day 1, really nothing remarkable I can talk about. The CCS cases, they were a blur. You'll have the 10-minute and 20-minute cases. The 20 minutes, you'll have plenty of time. Like I was kind of finishing those cases with so much extra time. But the 10-minute cases are the ones you want to practice and make sure you're fast enough to get those done efficiently within the amount of time. Otherwise, I'd say you don't have to worry about 20-minute cases. You'll have plenty of time. Think your steps through. It's just that for the 10-minute cases, you want to be quick and be efficient, basically. At this point, I will transfer it over to my good friend Eiad to share his experience.
Thank you, Omar. Just quickly sharing my personal experience as well. So for me, it took about 6 weeks of preparation. I was working as a TA at the time. If I was home and not really working, I'd say that 4 weeks are more than sufficient for preparation to get UWorld done and to get the CCS preparation out of the way. In terms of the resources, I used pretty much everything Omar mentioned. UWorld for step 3, biostat review, Randy Neal's videos, first aid for step 1. And then for CCS, I'll talk about the resources that I used and basically all the resources that are out there. I'll talk about them in a second. But just one thing to touch upon briefly, Omar just mentioned that he had I think 3 days between day 1 and day 2. I personally did them back to back. So I did day 1 and then day 2 directly. And like he said, there are different schools of thought in terms of how far apart should you do your days. I think the rule is you have to do them within a maximum of 14 days apart. But in my mind, it was just like Omar said, when you're done with step 1 and step 2, you're done with the bulky stuff, with the hard stuff. So you sometimes just feel like, you just want to get this out of the way. You don't want to stress during the time in between. So I just prepared myself for MCQs and CCS at the same time. And I just knocked them both out of the way. Initially, I was worried that, after a very long day of day 1, maybe I wouldn't have the stamina to do the 9 hours on day 2. But I think just the adrenaline of the exam day just gets you through things, and then you're done before you know it. So many people go to different methods, and there isn't like a well-established method that works better. Just see what works best for you. But people have done it back to back, and people have done it 3 days or a week apart, and both schools did okay. Now, in terms of CCS, since this is the only new thing that is in step 3 compared to the prior steps, CCS is basically this computer simulation. This is an image of what it looks like exactly on exam day. And as you can see here, you have like top left, you have the interval history and physical exam. You have reports, orders, review the chart. And then you have results, and like you fast forward the clock, and then you also have the location in the top right, where it's like either the office or like the inpatient setting or the ICU or home. And really what this is it presents you a case, and then you're supposed to basically figure your way around this case and kind of manage the patient as if they were your own, as if it was a real life patient, until they eventually get better. The point of these cases is not to diagnose what the person is presenting with, because a lot of times the diagnosis is very clear from like the first sentence. They give you like all the stereotypical findings of a known diagnosis, but the issue here is, how do you manage someone? How do you stabilize an unstable patient? Or how do you approach something that you've never seen or heard of before, or so on? So I think of it like a video game, and you're just like you have different buttons and you're trying to play with things until you figure out a way to win, basically. That's how I thought of CCS. Omar, can you go to the next slide, please? There are some resources. There's Crush CCS, which is around the 200-page book. And then there's UWorld CCS, of course. And then there's another website called ccscases.com. Crush CCS is kind of like, it's a really fast overview, introduction to CCS and how you approach cases and the things that you're supposed to order in a very concise and efficient way. It takes like 1 or 2 pages per case. And I just flew through that before I started UWorld and ccscases.com. And I think that kind of laid a good foundation before I started, going into UWorld and CCS cases. The downside is, I think the book is published in 2013, so some of the management things are kind of outdated. But like I said, it was just nice to lay a foundation. UWorld CCS, this is the first time we're going to hear that, it's something that's done by UWorld, but it's not actually as high yield as the other things. UWorld, like Omar said, is the gold standard for MCQs and for basically step 1, step 2. But for CCS, in my personal opinion, I think it's poorly made. I think they just, brushed over it and they didn't really give it the time, and it's not the UWorld quality that we're used to. So some people still use that as their resource, but I personally did not benefit that much from UWorld CCS. The one that I strongly benefited from, and I recommend to anyone that asks me, is ccscases.com. This is going to be a separate subscription that you have to pay for. I think it's like $100 for a 3 or 6 month subscription. Well, basically it has 100 or 120 cases. I think now it's like 120 cases. The nice thing about them is, first of all, the software is very similar to the exam software. Number 2, they score you. So you do the questions, and then they tell you this is what you missed, and for this is your score, and so on, which is something that's missing in UWorld CCS. And also in the real simulation on the MBMU website. And then the last thing is that, what was I saying? Yeah, so the last thing is it's kind of concise, and to me the cases sounded similar to the exam cases. So I personally really liked ccscases.com. There is like an online tutorial sample cases on the MBMU website. I think they have 6 cases right now. They're online. It used to be like a program when we were preparing for it, but that basically has the same software as the exam itself, but it does not grade you. So that's just something for you to do. So, I did all these things. I have I have a post on the Facebook group, and I mentioned in detail all the pros and cons of each of these resources. Just things for you to look at, because these things are not going to be that important now if you're not preparing like right now. But this is something that you can refer to later on, and you can pick whatever. Like I said, for CCS, there isn't a gold standard that people use. Basically, anything that you do just to get the hang of the software and what to do with patients and so on, that's going to be more than enough. In terms of my exam experience with CCS, like Omar said, the 20-minute cases were kind of straightforward. They were easy to do. You finish before time, you got the time added to your break, and they're not really stressful. But then the 10-minute cases, these cases were kind of tough, just because if you're not sure what's going on, you kind of don't really have a whole lot of time to deal with the orders and with what do I need to do and what do I need to think of. And I think I had like a couple of cases where actually the time ended before the patient got better, and was feeling bad and so on. But so this is, like Omar said, this is something that you need to work on, just to practice time management for the 10-minute cases. Oh, and one more thing that I forgot about CCS cases. In the real exam, there's like a 1 or 2 second lag between the time that you press something and then the time that actually gets registered in the software. And you can simulate that in ccscases.com. So you can make it like a 2 or 3 second lag. So that gets you more used to the time management skills. And that's not present in any of the other ones. So, just some things for you to consider. But again, whatever you decide to do, you just need something to orient you with the CCS like software, and then you'll be good to go. And the majority, for the 99% of people, CCS is actually a booster for your score. It's not something that decreases your score. You just need to do well on the cases. You need to basically not kill any patients, and your score is going to be boosted by CCS. And then finally, in terms of results, I know because I fret about this stuff a lot. So the results, they take exactly 2 weeks. They come out on the second Wednesday after day 2. And then on Monday of that week, the print permit link will disappear. Anyone that did step 1 or step 2 before knows what I'm talking about. So this is the link here because it's different this time. It's on the MBMU website, not the ECFMG website. And then there's like a status that gets changed as well on the FSMB website on Tuesday. And then the nice thing here is that you gain 9 extra hours basically because the score is available at 12 a.m. instead of 9 a.m. in the morning, like step 1 and step 2. And then if you do decide to do your step 3 before you start residency, just remember to update your ERAS transcript. You just go on ERAS. By the time you're doing this stuff, you're going to be aware. So you just need to update that so that the programs get an updated USMLE transcript with the step 3 score. And then also you can update programs if you take it during the match cycle. I personally updated my programs, and I got 2 interviews after I sent programs that I was done with step 3, even though it was relatively late in the season. It was end of December. So that's definitely something that I think you should be doing if you do it before you start residency. I think that's all from my end. Omar, if you have anything else to add, otherwise we're happy to take questions.
No, that's pretty much it. Yeah, I think you highlighted the CCS cases pretty well. Really nothing else to add. I guess just practice, get used to the software, and again, build some certain knowledge base about the cases you'll be encountering. Some people read up to date and stuff like that, again, as a means of just understanding how you would approach such cases. But otherwise, I think it should be pretty manageable if you've done step 1 and step 2. And again, depending on your circumstances, you'd want to assess when you want to give the step 3. And we're more than happy to take any questions, any comments anyone has. Feel free.
I think we did our job pretty well, huh? No questions?
Already no one cares about step 3 is typical.
That's true. Yeah, exactly. Okay, then I'll write my email in the chat. If anyone has any question, you can reach out anytime.
There's a question I see.
Is there?
Yeah, in the chat. So the question is, did you guys take, it's actually directed, it's to me. Did you guys take step 3 before residency? If so, do you think it mattered for your match? Well, so I think Eiad shared his, kind of take on that. He was able to get a few extra, interviews because of the, step 3. Well, I did it very late. As I mentioned, my day 1 was on 18th of March. That's 3 days after you find out where you match. And then day 2, and then on 18th, I did the first day. 19th, I found where I matched. And then 22nd, I did the second day. So it was definitely way too late for it to even be considered for anything. But I think my purpose was to just get it done before I start residency. I didn't want to, deal with it when residency begins. And, so yeah, then I have some classmates who are now trying to prepare, now trying to kind of arrange time to give the exam, and they're having to take time out of their, research month or other lighter months. And we're getting to enjoy those months basically because we don't have an exam to study for. So I think it does, and in intern year, you'll want to make the most of every little free time that you have. And I think having to study for an exam, in that free time is, it's not cool basically. So I think it's generally should be good practice to get it done with before residency starts, regardless. One thing is for it to benefit you in your residency application, whether, if you're aiming for an H-1B visa or you want it to, count towards your application for applications taken into consideration, or even after you match and before you start residency, just getting it done with. So you don't have to deal with it when residency starts.
Thank you, Doctor, for the wonderful presentation. It was indeed very beneficial. We truly value your experience and guidance. I'd also like to thank AMBOSS for their constant support in helping students secure their careers. To everyone in the audience, thank you for joining us today, and our team hopes that you found this session as informative.
Sorry, I'm sorry to cut you off. I think there's one more question. Just answer it quickly. If we want to have step 3 scored by the time of the application, when is the latest you would recommend taking it? So like I said, this is program dependent wherever you match, but the majority of programs, their deadline was March 30th. So basically just 10 or 12 days after you know where you matched, just so they can give themselves enough time to work on the H-1B visa so that you're not delayed. So this is the deadline, the actual deadline. But if you don't want to miss out on a single program that has any deadlines or so on, the earliest deadline that I saw was December 30th. But this was, like I said, just for a few programs. And this is speaking from an IM standpoint. So just a few programs out of like 250, but the majority are in March. So, but definitely, if you're doing your exam in April or May, you're not doing it for the H-1B visa. You're doing it for the reasons that Omar mentioned about, getting it out of the way before intern year and stuff. But you're not gonna help your visa status.
On top of what Eiad mentioned, so if your objective is to do the step 3 as a means, let's say someone wants to compensate for a lower step 1 or step 2 score, or they, in some way want to boost their application, that would then have to happen much earlier. That would have to happen either before you submit the application or around that time, early period of interview season, so your step 3 can be considered as part of your application, basically. So again, depends on what your circumstances are, what the purpose is for you to be giving the step 3. That would then determine, what kind of timeline. Just keep in mind, it takes about 2 weeks for the results to come out, and using that as a guide, you can then decide, how early you need to get done with step 3. Any other questions? That's pretty much it. Thanks, Luqman. I appreciate it. You can continue. Sorry.
No problem. If anyone else has any questions, then please feel free to put them in the chat or unmute and ask them. Before we finish, I'd like to ask all of you to follow us on Instagram and Twitter, and to subscribe to our YouTube channel to receive all the latest updates on our events, webinars, etc. I will insert the links to them soon. Also, if you want to contact us in the future, you can do so. I'll place the link over there too. Again, thank you, doctors, for the wonderful presentation.
Luqman, I'm sorry, I'm going to cut you off one more time. There's another question.
Yeah,
Um,
it's okay.
Yeah. So if you don't do step 3 before residency, do all programs call you on a J1 visa only? Yes, by law, you're not allowed to take the H1B visa unless you have step 3. So that's not program dependent. That's step 3 dependent. So if you're not done by if you don't have the result of step 3 by March 30th or 31st, you're not going to be eligible for an H1B. And I forgot to mention, when I was talking about the deadline, like end of March, I mean the results back by end of March, not doing the exam by the end of March, because that's going to be too late. So most programs, when they say the deadline is end of March, they mean the deadline for having an actual score. So your exam is going to be like, your deadline is like mid-March. Luqman, any final words?
No, doctor, that is it. Thank you so much.
Thank you guys.
Thank
Appreciate
you.
it. Thanks for having us.